Hi everyone. Good evening. Good evening. Good evening. Let me know where you're connected from. Good evening. Good evening. Good evening. Good evening, everyone. Good evening. Welcome on board. Good evening and welcome to the amazing session, Family Planning and Contraception. So, we'd love to know where you're connected from tonight. So, just kindly chat in the comment section so we can get to meet you and connect with you as well. Good evening. I will just keep waiting for more people to join in. Good evening. Good evening. Good evening. Hi, good evening. I see one person joined in. Let me know where you're connected from. Good evening. Nice to have you on board. And welcome to Family Planning and Contraception. I would love to meet you. Please kindly type out your name and where you're connected from, and let's get to meet you as well. All right, welcome. Please, as you join in, let's get to meet you. Kindly type out your name and where you are connected from. Thank you. More people are connected. Please, nice to meet you. Welcome to Health Talk with Kemi, a YouTube platform designed to empower both male and female to take informed decisions about their health. And we are so glad to have you on board tonight. But firstly, we'll get to meet you. Could you please introduce yourself? Kindly tap out your name and where you are connected from tonight. We'd love to meet you. So your name and where you're connected from as a way for more people to join in before I bring up Dr. Johnson. Because I know she's ready for us. She's backstage. I can see her backstage looking all beautiful and glammed up. And she's ready to dish out so much knowledge on family planning tonight. But before I bring her up, I need to ensure that people on board. So kindly go back to your group, tell people family planning and foundation live is live, is live, is live. Let's get more people to join us and to have access to the amazing training tonight, right? I mean, we're having an amazing training tonight, so I don't expect that will be few. So kindly go back to your groups, please. Post on your status, share with everyone, and let's have an amazing time together with Dr. Dunsin. Meanwhile, I still don't see the names coming in. Please let us get to meet you. I still don't see the names coming in yet. Let's get to meet you. We are live, we are live, we are live, we are live. Everyone joining, we are live. Okay, why can't I see the comments coming in? Hmm. Looks like I can't see the comments coming in. I'm supposed to see them. Okay, yeah. I see the comment now. Ooh, I see the comment now. We have Oshuma Kinde Uluwatobiloba. Nice to have you on board, Dr. Oshuma Kinde. Thank you for being here. I see Rashida Trufos. Nice to have you on board. Good evening, ma'am. Welcome. I see Elubadebo Adedayo from Greater from Ife. Nice to have you on board. Thank you for joining. I see Miss Okeshola from Lagos State. Thank you for joining and nice to have you on board as well. So tonight we are talking about family planning and contraception. And I can tell you it's going to be an amazing session. Many people are not aware about what family planning is, the different method we have. And I feel like family planning is not just for women, right? Okay, the major part is for women, but even the male, our dearest husbands to be, you have to be aware as well, because don't let the woman go through everything alone. I don't understand this life. Well, like most times it's just on women. So we want the men to be informed as well. So our dearest men, you are not left out from tonight's session. Please join in, so you have the knowledge as well to empower your wife. Might not even know, so you might be the one to tell the wife, right? So please, let's get everyone on board and let's prepare for an amazing session tonight. And I'll bring up Dr. Donsin. I'm bringing her up in just 1 minute. I'm about to read her profile, and I hope you are getting ready. If you don't have a notebook with you, go and get one, and please ask questions as well. In case you have any question after tonight's session, please ask questions, because it's going to be very amazing. All your questions will be answered as long as you send in your questions as well. So I'm about to read our profile as I bring up Dr. Dunsin. I'm about to read our profile. Are you ready, Dr. Dunsin? Are you ready as well? We are ready to receive. All right. I'll read our profile right now as I bring her up. And in the meantime, please keep reaching out to people, keep telling people we are live, join in, and let's get a greater number of people to be connected tonight for tonight's amazing session. Are you ready? Let's meet the speaker. Let's meet our speaker. Let's meet the speaker. Right, Dr. Oluwadunsin Oluwaseyitan Adesopo. Dr. Dunsin, I apologize if I didn't pronounce that right. Is a dynamic medical doctor and an alumni of the prestigious Obafemi Awolowo University. She's widely recognized for her passionate advocacy in reproductive health, with a particular focus on family planning and improved health outcomes for young people and underserved communities. She is a dedicated reproductive health advocate. Dr. Johnson has collaborated with both national and international organizations to champion access to reproductive rights and quality health care. Her work bridges clinical expertise and social impact. May I take a pause? We have an international person with us tonight. So you already know. I can see her smiling as well. You already know what you're about to get. We have an international person. We have an international speaker with us tonight. So you already know where I'm going to, right? Beyond her clinical contribution, she's also a prominent health and lifestyle content creator. She skillfully leverages digital platforms to simplify health education, empowering individuals to make informed decisions about their well-being. Dr. Dunsin is the author of a recently published book that provides practical guidance on birth control options, reflecting a commitment to accessible health information. Her leadership in reproductive health has earned her both national and international recognition. I'm supposed to be seeing applause, clapping hands in the comment section as I'm reading this profile, right? Highlighting our ability to foster strategic partnerships and implement sustainable health and youth-focused interventions. Combining medical excellence, digital innovation, and a strong commitment to social impact, Dr. Oluwadunsin continues to be a trailblazer in the global health advocacy place. With a standing ovation, clapping ovation, screaming ovation, all the ovations we have. Could you please welcome on stage with me? Can you welcome our speaker tonight, Dr. Dunsin? Dr. Dunsin, I'll bring you up right now, and I look forward to an amazing session as well. Thank you.
Hi. Good evening, everyone. Let me know if you can hear me. Oluwakemi, am I audible from your side? Oluwakemi, let me know if I am audible.
Yes, I can hear
Okay.
you. You are
Okay.
audible.
Okay. Good. So, can you please let me share my slide? Okay. Hello, everyone. Good evening. No, good morning. Good evening. No, good morning. Good afternoon. Good evening. Wherever you are joining from. both here on YouTube and Instagram. Thank you for joining, and a very big well done to Oluwakemi. Thank you so much for this invite. It means a lot to me. And today, Oluwakemi has said I should talk about family planning. No, I don't know. I don't know why people always think, oh, she's the goddess of family planning, but I think I am grateful I have that training in that specialty. So let's go straight to the presentation. Firstly, I would like to thank Rachel Phelps for letting me use a slide. Medical Student for Choice happens to be one of the international organizations I work with, and I'm grateful they allowed me to use this slide for ease. So when you hear family planning, what exactly comes to your mind? Whenever I ask people such questions, they're always like, family planning is just about preventing pregnancy now. And in my mind, I'm like, family planning is actually more than that. It's more of a way of thinking and living that is adopted voluntarily upon the basis of knowledge, attitudes, and responsible decisions by individuals and couples in order to promote health and effectively in order to promote health and the welfare of the family group and effectively contribute to the social development of the country. You will notice that in this long definition of family planning, according to the World Health Organization, you didn't even say anything like pregnancy. That is because family planning is more of a decision you make as an individual and as a couple. It's more of you saying, "Oh my God, I don't want to get pregnant now, so I will abstain from sex." It's more of a couple coming together and saying, "Oh, this is how we will plan our family. Oh, we are waiting till the next 1 year or 2 years before we have our children." This is more of a decision of you setting out a plan, of you setting out a calendar on how you really want to build your family. And it can be done naturally or artificially. By naturally, it means it's literally means you are not making use of any of the contraceptive methods. You are doing it naturally, meaning as a lady, you know your cycle perfectly well. You know when to have sex, you know when not to have sex. Like, unlike when you use the artificial methods, which involves you picking a contraceptive methods. Now, what is contraception, by the way? Contraception is a voluntary prevention. I want you to take note of the word voluntary because you are doing it intentionally. You are making that decision. It is your choice. It is a voluntary prevention of pregnancy despite every act of coitus by interfering with the processes that leads to conception. Now, what do we mean by an ideal contraceptive? What do we mean by an ideal family planning method? For me to say a contraceptive method is ideal, I want it to be very effective. It has to be effective because if it's not effective, you will see a lot of people coming down with unwanted and unplanned pregnancy. It has to be safe and free from side effects. Of course, not every method can be free from side effects. For the just to even make it clear to everyone, every method has its own side effects. It just varies. Every method has to be very convenient to use by the patient, and it must not be dependent on the provider, meaning this method must be in such a way that this patient doesn't have to be coming to me every single day because of one complaint or the other. Then this method must be long acting and it must not be related to coitus, meaning even when the patient is on a method, she is able to still have sexual intercourse with her partner easily without interrupting it. Therefore, a family planning method to be considered to be ideal, it must be available, it must be accessible and affordable. You see this last point, it is a major issue in Nigeria, despite the fact that people believe everybody knows about family planning. To be sincere, let me tell you this: 37% of women in reproductive age group, is only 37% of women in reproductive age group that have access to to family planning services in Nigeria. We're not even halfway there, just 37%. So that means we still have a lot of work to do in terms of creating that awareness, in terms of making it accessible, in terms of overcoming all the barrier. And by barrier, I mean the cultural barrier, the social barrier, and the religious barrier. We have to make it accessible irrespective of the geographical zone. So today I'll be talking about different types. So in a simple man classification, family planning can be divided into the temporary and the permanent. So by the temporary, it means there are methods that are easily reversible, while the permanent means it's not reversible. So before I go ahead, let me debunk this myth. Everyone believes family planning method causes infertility. Well, let me tell you this: family planning method does not cause infertility. It doesn't cause infertility. You not being able to get pregnant when you are using a temporary form of family planning method is it's more of your choice. You not being able to get pregnant when you are on the permanent method of family planning is more of your choice, and it is not a side effect from any of the family planning method. So let us debunk that myth. So for the temporary family planning methods, we have the short acting, we have the long acting reversible, we have the hormone containing contraception, we have the barrier methods, we have the emergency contraception. While for the permanent type of family planning, it's majorly it includes vasectomy in male and bilateral tubal ligation in female and hysterectomy in female. So this diagram basically talks about the effectiveness of each of these of each of these contraceptive methods. You can see in these slides that the least effective is the withdrawal method. Some people say female condoms. Well, probably because people tend not to really make use of it, so they don't really have the adequate knowledge of how it's being used. Withdrawal method, as I will always say as a family planning advocate, is the less effective. So many people will say, I am a very good I'm very good in pulling out. I am very good. I know when I'm about to ejaculate. Truth be told, as a guy, you pre-ejaculate. As a guy, you pre-ejaculate, and God help you. Let your sperm cell be in that pre-ejaculation. Just get ready for name ceremony in the next 9 months. So I will not advise anyone to use the withdrawal method because it's more of a 50-50 chance. You can be lucky and at the same time you cannot be lucky. Then you also see eye up in this diagram that the implants, the IUD, female sterilization, vasectomy, injectables are quite effective. Now let's talk about the long acting reversible contraceptive methods. The first one I'll be talking about is the implants. The implants is now quite common nowadays. So implant is more like it is a hormonal method. You know the way matchstick looks. Yes, that is exactly how implants look. So implants is like a matchstick that is inserted underneath the skin on the hand. So it is inserted subdermally into the skin. And one thing about the implant is that as a lady, if you get it inserted into your skin today, please and please, you have to wait for the next 7 days before you can play rough. Meaning, within the first 7 days of getting the implants, you still have you can still get pregnant and you will not like it. And that is why, as a doctor, whenever I counsel my patients on this method, the first 7 days of using or of the first 7 days of getting the implants, try to use a barrier method, preferably a condom. After the 7 days, good, you can now start playing rough. If you know, you know. So it contains progesterone and it is safe immediately after postpartum. Teenagers can make use of it. If you are breastfeeding, you can use it. Even if a lady has HIV, she can use it, and it is effective for as long as 4 to 5 years. Now, one good thing about implants is that when you remove it, your ability to get pregnant returns within a week. Sometimes it can extend to a month depending on your body type. Now, how does this implant works? It acts most of these methods, they act by inhibiting ovulation. Most of the hormonal methods act by inhibiting ovulation. You might notice some changes in terms of your menstrual flow. It can be infrequent, it can be prolonged, it can be irregular, and sometimes it can cease during that period you are on it. So these days the insertion of implants has been made way easier. Instead of having to use the whole forceps to inserting it, nowadays implants comes with the inserters, which makes it very easy. So as the method is administered, we also consider the pain of patients as well. So prior to the time we insert the implants, we anesthetize the area such that when we anesthetize the area, the patient won't feel the pain before using the inserter to, insert the implant So the next one is the IUD. I love the IUD. Over the few years, so many people tend to prefer the IUD. Although to an extent some females tend to complain about how painful it is in terms of insertion, but trust me, it's still one of the reliable methods that I would recommend for any woman, and it has an effectiveness of 99.8%. Please, what else do you need out of 100 marks? Or 99.8%. It is safe and it can be used immediately after birth, that is postpartum. However, for the hormone containing IUCD, it is not recommended for women that are hypertensive. If you are hypertensive in pregnancy, postpartum, don't consider a hormone containing contraceptive method, because if you keep using hormone containing contraceptive methods when you are hypertensive, your BP keeps going up. So it is better for you to consider the copper IUCD. The copper IUCD does not contain hormone, and it is very much safe for you when you are after childbirth. If you are hypertensive, then you can also consider the barrier method like the condom. So the IUCD last for up to 7 years. You can remove it anytime you want, and your fertility returns immediately. So how does it work? So the meaning of IUCD means intrauterine contraceptive device. IUCD means intrauterine contraceptive device. So it acts by thickening the cervical mucus, thereby not allowing the sperm to move all the way to the site where it will fertilize the egg. Within the first few months of insertion, you might notice some spotting. You might notice that your menstrual flow is either heavy or it is light. Trust me, those are some changes you will notice within the first few months, but as it goes on, you things become normal. So it's nothing to be worried about or to be alarmed about totally. So I've talked about the copper IUD. It is very easy to use, and to make things easy, it has a rope at the end, such that after your period, we always tell women to always check if she can still feel the rope down there. If she says she can't feel the rope down there, I will advise her to come right to the clinic for it to be checked immediately. So this slide basically talks about the difference between both the copper IUD and the hormone containing IUD, and you being able to make the best choice amongst the two depending on the one you want. So this slide just talks about how it's been inserted. So just to debunk another myth, when the IUCD wants to be inserted, we don't put our hand inside. No, we have an inserter that is being used to insert the IUCD to make things way easier for us. So this slide is basically talking about the long acting reversible contraception, making you know that it is the most effective, and it has an efficacy of more than 99%. What else do you need? And it is very safe. It is very safe, and so many patients have given good reviews about it. Just a few would complain about the pain they feel, but a good number of women tend to prefer the implants and the IUCD because they don't have to think about it every day. So let's talk about the short acting hormonal contraceptive methods. So the injectables is more of a you are the one giving yourself the injection. Sometimes you are the one, for people that have the mind to, but sometimes some people prefer coming to the hospital. So it contains progestin only, and it can be used by anyone. But if you are hypertensive, please try as much as possible to avoid it. Please try as much as possible to avoid it. Then it is used every three months. This method is the commonest method that is used amongst market women. That's one thing I have noticed. It's commonly used amongst market women. It also acts by inhibiting ovulation as well. Then you might notice some changes in the bleeding pattern. Now, one thing I want you to note about now, one thing I want you to note about the injectable is that even when you stop making use of it, even when you stop making use of it, your fertility won't return until about 3 months, and sometimes it can extend. That is because the hormones being released by this injectable is fats absorbable, such that even when you stop making use of it, a little bit of that hormone is still being released from your fat. So you might notice that even after 2 to 3 months of stopping it, your fertility won't return, or your fertility won't return until about 3 to 4 months. That is when the fat must have released all the hormones. So if you are in such situation, you need to be very, very patient as a lady. So let's talk about the oral contraceptive pills. Whenever I talk about oral contraceptive pills, I make ladies know that before selecting a contraceptive method, you need to sit down and ask yourself some questions. So as a word of advice, because your friend is making use of a particular method doesn't necessarily mean that method is suitable for you. Remember, it is your body, your choice. What will happen in female A might not happen in female B. What will happen in female B might not happen in female A. So for oral contraceptive method, for the oral contraceptive pills, you are literally taking pills every single day. So as a lady, before taking it, before selecting this method, you should ask yourself, are you comfortable taking medications every single day? Are you ready to set alarm to a particular time of the day so that you can remember to take your medications? We have some of us on this platform that don't even remember to take our anti-malaria drugs, not to talk of oral contraceptive pills. So before taking this option, you need to ask yourself this question: do you really want a method that you have to be thinking of every single day, or you want a method that you have to be thinking of every 3 months? That is when you have to consider the injectables. Or do you want a method that you have to just think of you have to think of every 3 to 5 years? That is when you will have to think of the implants or the IUCD. So before considering oral contraceptive pills, please sit down and think, because by the time you start missing your contraceptive pills every day, every single day, you are at high risk of coming down with unplanned and unwanted pregnancy. And I know as a lady, you don't want stories that touch, right? So sit down and ask yourself that question before considering the oral contraceptive pills. So these pills requires you taking it every single day, every single day, and it has an efficacy of 91%. And the good thing now is that once you stop it, your fertility returns almost immediately. How does it work? It works by inhibiting ovulation again. So most of these methods work, like they work similarly. As long as you don't ovulate, your chance of getting pregnant is very, very slim. So let's talk about methods that that protect against STI. STI means sexually transmitted infection. Another question you need to ask yourself as a lady is that, do I want a method that would prevent me from getting pregnant and also preventing me from coming down with sexually transmitted infection? In this case, you have to think of a barrier method, and the most effective is condom. Condom has been seen to be very effective in preventing sexually transmitted infection. So the next slide, what is the right way? Please, if you can still see my slide, let me know. I can you still see my slide? Kemi, are you there? Okay. Sorry about that. The network was quite it was misbehaving. Please let me know if you can hear me. Am I audible? Am I audible? Okay, okay, okay. Thank you, thank you. So sorry about that. Now I was going to talk about the okay. I was going to talk about the appropriate way to wear a condom. To wear a condom. So I have heard so many people complain about condom breaking during the activity. I've heard people say that, oh, this and that I got pregnant despite the fact that I wore condom, this and that. So the appropriate way to wear condom really determines the efficacy of the of the contraceptive method. So we have different type of condoms. We have the male condom and the female condom. The female condom is not really well known. That is because of the it's not commonly used in this environment. Then also most females tend to be uncomfortable putting it on because it requires a lot of technicity. So they prefer when their male partner wears it. So at what point does your male partner put on a condom? At what point does your male partner put on a condom? Your male partner should wear a condom when he is fully erected. That is the best time to wear a condom. That is the best time to wear a condom. So you set the package carefully. Don't use your teeth. If you see your male partner using his teeth to cut the condom, please tell him to just get another one and open it appropriately. We have seen scenarios whereby while trying to use the teeth to open the condom, they end up perforating the condom and eventually leading to pregnancy. So you place the condom on the tip of an erect penis, you unroll the condom to the base of the penis, and after ejaculation, hold the condom in place. Hold it in such a way that there won't be any form of leakage from anywhere where and withdraw the penis while it is still erect. You slide the condom off and avoid spilling of semen near the partner. Wrap the condom in its package and dispose it in a trash. And never ever use a condom twice. If you want to go another round, it's best to use a new condom totally to avoid stories that does what? To avoid stories that touch. I hope we understand. Please let me know if I'm still very much audible um on the platform. Thank you. So thank you. Please, is my slide moving over there? Okay, it's moving now. So up next, let us talk about another method. That is the lactation amenorrhea. Whenever I hear women talk about this, I'm always smiling because I'm waiting for that point where I will catch them. So last week in my clinic, a woman came with her 1 year old baby, and she said, um, so last week, a woman came to my clinic with her 1 year old baby, and as she sat down, I knew something was wrong by just looking at her, and I asked her what the problem was, and she said, "Doctor, it seems I'm pregnant though," and I'm like, "Okay, you're pregnant. Is that not good news? This and that. I feel you should be happy that you are pregnant now." And she said something. She said, "Doctor, I'm not happy that I'm pregnant too." And I asked her why. She said, can't you see my baby? She was holding a 1 year old baby. Like, can't you see my baby? My baby is just 1 year and I'm pregnant again. And I'm like, okay, what happened? What did they tell you when you put to bed? They told me that if I don't want to get pregnant, I have to do exclusive breastfeeding, this and that, that it will help cause amenorrhea, meaning she will not menstruate. And I was like, yes, that is correct. Did you try using another contraceptive method? She said no. And I was like, that was where you made a very big mistake. Now, as a breastfeeding mom, please and please, even though it is written there that it is 98% effective, I beg, I am begging you in the name of God, don't depend on it. It is a 50-50 thing. Like, it is a 50-50 thing. I have seen so many women falling victim of this and they got pregnant barely 3 to 4 months postpartum. I have seen a woman who started her menstruation within 3 weeks of putting to bed. The reason why they always tell women about this lactation amenorrhea is that it is expected that as a woman, when you are exclusively breastfeeding your child, it's expected that you won't menstruate during that period. But do you know that it gets to a point that you ovulate before you see blood coming out as menstruation? You must have ovulated before then. The mistake this woman did as my patient is that she had an unprotected sexual intercourse while she was ovulating. She was thinking, oh, because she has not seen spotting or she has not seen menstruation, that she's safe, not knowing that before menstruation even comes up, ovulation has to happen. So please and please, if you're in this situation or you know anyone that is depending on exclusively breastfeeding a child just to avoid pregnancy, tell her that it is not 100% effective. It is best to combine it with a barrier method, most preferably a condom. Thank you. Then another method is the fertility awareness methods for people that are very conversant with their menstrual cycle, that they know that, oh, they have a 28-day menstrual cycle and they are very sure that their body system cannot change. These are the people that tends to go with this method, but it is not fully effective because stress can make your menstrual period very long or very short. A lot of things can cause your menstrual cycle to be altered, and that is why you depending on this awareness method is not 100%, is not 100% effective. It's not 100% effective. So how do you know when you are ovulating? When you are ovulating, you will see cervical secretion. It is clear, it is sticky. Then you might also notice an increase in your body, in your basal body temperature. Then during that time, you might also notice that you have this increased urge for sexual activities. When all these are happening, just know that you are most likely ovulating, and during that period you are very much fertile. So if you are someone that has a 28-day cycle, you will most likely ovulate on day 14. However, you don't have to wait, your body system doesn't have to wait till day 14 before you get fertile. You are very much fertile from 2 days before your ovulation day and 2 days after. So from day 12 to day 16, just know that any rough play during that period, you should get prepared for your baby to come up, for pregnancy. So try as much as possible to know your body system, try as much as possible to know your menstrual cycle to avoid stories that touch. So this is still explaining how the beads are being used, and this slide just talks about the symptoms to know, to take notes when you are ovulating, just to be very much aware of your fertility period. Now let's talk about emergency contraception. When do you use emergency contraception? Emergency contraception is used when either when you have an unprotected sexual intercourse. And we have two types of emergency contraception. We have the emergency contraceptive pills and the IUCD. The IUCD too can also be used as a form of emergency contraception, but not in all cases. But most times people prefer the emergency contraceptive pills, and it is best to be used. You can use it within 5 days of unprotected sexual intercourse. However, it has been seen to be more effective when you use it within the first 24 to 48 hours. Some will say 72 hours, but you have to use it as early as possible after the unprotected sexual intercourse. Now, let me make this clear to everyone. Emergency contraceptive pills isn't a candy. I have seen ladies buy emergency contraceptive pills like they take it as if they are taking candy, and they don't know that the more they take it, the more harm it causes. So if you are in that shoe, if you are in that situations, try as much as possible not to be using emergency contraceptive pills like your candy. It's not good. It will make things worse. So some common myths about it is that some people believe emergency contraceptive pills will cause abortion. No, emergency contraceptive pills doesn't cause abortion. It doesn't cause birth defects. It doesn't increase risky sex. Emergency contraceptive just prevents you from ovulating and thereby preventing you from getting pregnant. Um, so this slide basically just talks about the emergency contraceptive pills and how it is being used. So whenever I advise females to buy emergency contraceptive pills, it's best to buy the one pill own, because the one pill own has the higher content of the hormones that would prevent you from ovulating. So up next is more about how to you screening yourself, you asking yourself some questions before you select any of the contraceptive methods, which I have explained earlier on, which I have explained earlier on. Then this slide basically talks about when a woman is protected from pregnancy, and I have explained some of it. If you are making use of an IUD, a copper containing IUD, you are immediately protected from getting pregnant. But if you use the implants, the pills, the patch, the injectables, the hormone containing IUCD, you are not protected from getting pregnant within the first 7 days. It is after the first 7 days that you are protected from getting pregnant. So there are some tests that we always advise women to do. As a woman, if you are hypertensive, as I said earlier on, you have to consider some methods, and at the same time you must not consider some methods. As I said at the early parts of this presentation, you have to avoid any hormone containing contraceptive if you are hypertensive. It doesn't, like, it just makes things worse during that period. So try as much as possible to avoid that. So up next, about the contraceptive pills that you have to be taking daily. um Whenever ladies come to my clinic and they're like, what if they miss their pills, what should be done? If, for example, you took your pills till yesterday and you forgot it today, immediately you remember that, oh my god, I've not taken my pills today. Please take it as early as possible. Take it as early as possible. If you miss your pills 3 days or more in a row, or if you start a pack 3 days or more late, please use a condom to avoid stories that touch. Now, how do you get to remember your pills? I will always tell my patients that it's best to set to have a particular time of the day when you make use of the pill, and it is best to even use it in the morning, so that you know that as you are waking up, You just make use of the oral contraceptive pills, so that by the time you start your day's activity, you won't forget to make use of the pills. So if you are someone that prefers the oral contraceptive pills, it's best to select a particular time of the day, and most preferably in the morning. So up next, for women that are living with HIV, women living with HIV can safely have an IUD inserted if they have a mild or no clinical disease, whether or not they are on antiretroviral therapy. Then women who have HIV infections with advanced or severe clinical disease should not have an IUD inserted at all. Then if a woman becomes infected with HIV while she has an IUD in place, it doesn't necessarily need to be removed as long as she's on antiretroviral drugs. An IUD user living with HIV who develops advanced or severe clinical disease can still keep the IUD, but should be closely monitored for any form of pelvic inflammatory disease. Please, let's take note of that. So for the hormone containing contraception, it should be avoided in females that have any form of cancer, especially people that have breast cancer. Then also for the hormone containing contraception, especially the combined or hormonal contraception, it has a few contraindications. It is contraindicated in females that are at risk of having clots, in females that are at risk of having stroke, and females that have uncontrolled hypertension of a systolic of more than 160, and a diastolic of more than 100. So as a female, try as much as possible to check your blood pressure over and over again before even considering taking any form of um birth control options. So let me make this clear. All birth control options are safe. They are very much safe. Of course, as a female, you might notice some side effects, but these side effects are not for a very long time. But if you notice that you are not comfortable with any of these side effects, it is best as a lady to immediately visit the health professional, or just go to your clinic and let the health professional or the nurse, or the nurse to know that oh, you're not comfortable with this method and you would like to change it. It is better for you to speak out than for you to just keep all the side effects to yourself and keep managing it. Speak out as early as possible if you know you're not comfortable with any of these side effects, to avoid stories that touch. Now, IUDs are safe in people who haven't given birth. Please note that IUDs are safe in teens, and teens can also tolerate IUD placement as well. So this slide basically talks about the safety of contraception. Contraceptive methods are completely safe. This slide basically talks about the permanent contraceptive methods, which I have talked about. In the females, it is the bilateral tubal ligation. That is when the fallopian tube is clipped clipped and cut off. So the fallopian tube is the site where fertilization occurs. So once it is clipped, the sperm can't even by any chance fertilize the egg. For the males, the permanent contraceptive method is the vasectomy. Now, I want you to know that you opting for a permanent contraceptive pills doesn't stop you from having your sexual activities. You can still very much have your sexual activities and enjoy it with your partner. So, in conclusion, after these years of advocating for an increase in the awareness of family planning methods, and increase the um in the in the accessibility of these methods, I decided to put this into writing, because over the years, so many people had complaints about not having an adequate knowledge about family planning. And that was why I decided to write an ebook on that, which has adequately explained everything you need to know about each of the methods in a simple, easy to understand, non-judgmental way. You can always get this ebook on Seller by clicking on the link in my bio, or just visit Seller and get this book. So, thanks so much for listening, and it's been a pleasure speaking with everyone on YouTube and at the same time on Instagram. If you have any questions, you can send it to my chat right now, and you can always reach out to me on Instagram or in my DM. Thank you. Over to you, Kemi.
So much. Thank you so much. Thank you so much, Dr. Denson. That was an amazing session, and I know that everyone learned tonight, right? We learned, and we are more empowered to take control of any family planning method that you actually want to do in the future, be it married in a relationship, or even single, right? No knowledge is ever wasted. So right now, we'll be entertaining questions. Do you have any question regarding what Dr. Dunsin has said tonight? Any question? I'd love to take your questions. And if you cannot ask the questions here directly, you can please send a message to me or directly to Dr. Dunsin and just ask if you cannot ask the question here. Or are there any questions coming in? Should we wait a little more to see if questions will come in? Any question on any of the family planning method that she has discussed tonight? Do you have any question on IUD, on implants, on the pills? Maybe you've used one before and it didn't work for you, right? You know, I've had people come over to the clinic and say, oh, I used this IUD, I feel like I was getting fat, it didn't work. And then we tell them, why not use another method, right? Family planning is very effective. Like she said, the least effective is the withdrawal method, which I believe that my guys are abstaining from right now. And you know, if someone wants to come to you and say they want to do withdrawal method, you tell them withdrawal method is not actually effective. So if perhaps you've used any family planning method before and it didn't work, right, there are other family planning method which the person has discussed with us tonight that you can also use. You know, you can go over them again. Please, I beg you, go over this recording, listen to it, digest it, and pick anyone that works best for you, be it the pills, be it the IUD, the implants, but not the withdrawal, right? All right, so do we have any question coming in? Are there any questions? Are there any questions coming in? Thank you so much, Dr. Dunsin. Can we just say thank you so much, Dr. Dunsin? That was an amazing session. You know, I felt like I was in class all over again. I was seeing myself in my university class, seated and listening to my lecturer all over again. Thank you for that amazing session. We sure did learn a lot. So, do we have questions? Can we please say thank you to Dr. Dunsin? I don't see the comment again. I did not come in. No, I'm not just seeing the comments. Can we say thank you to Dr. Dunsin? Thank you for the amazing session. Okay, thank you. I think I see a comment now. Thank you so much, Dr. Dunsin, for the enlightening session. And I believe that everyone that listens, you know, one thing I love about teaching is that teaching always leaves a mark, right? When you teach people, you are also impacting them. And I believe that everyone that tuned in tonight learned a thing or another and is empowered as well for the future, because you might not even be planning to do family planning right now, but then you remember that this doctor said this particular day, and she said that. I mean, and it's very good to be knowledgeable about topics like this. So even if you are amongst people that are discussing this kind of topic, you can contribute. Why? Because you've learned, and I really encourage having knowledge about things. That's just me, saying it to you. So thank you for joining. Please do not leave this call without subscribing. Please click on the red button below to subscribe to the YouTube channel Health Talk with Kemi and get notified whenever we upload a new video or whenever we go live, because our next live session holds 17th of May. I'll be talking about immunization. We don't want to miss it, right? I learned that many people did not get fully immunized growing up. So I know you don't want to miss this session next week. So please subscribe to our YouTube channel. Hit the red button below to subscribe, and keep subscribing and get us to lots of subscribers, right? Thank you so much. So I think after all said, there are no questions. because I don't see any question coming in. So do I ask questions then? Do I ask questions and the winner gets a prize? Do I ask questions and the winner get a prize? Do we do that? All right. So what family planning method is the most effective? Let's see if you were listening. What family planning method is the most effective and what method is the least effective as well? Do I have the sharp, the fast fingers? Is that what they call them? The fast fingers. Do you have the fast fingers in the house? What family planning method is family planning method is the, shall I say, the most effective, and which one is the least effective? Do we have any fast finger, fast type in the house? Thank you, Umona IUCD. Thank you. You know, people present with pain, you know, maybe during the insertion. Yeah, that's true. But this lasts for 5 years, you know, 6 years, and I would recommend it any day, anytime. And the withdrawal, thank you so much, Dr. Oshomaki. They've told everybody now, do not withdraw again. All right, thank you so much for an amazing time. It was so amazing, and you guys made it more amazing. Thank you for joining in. Thank you for staying to the very end. Thank you for contributing. Thank you for typing. Thank you for always being here. Thank you for reposting. Thank you for sharing. But you do not ask questions, so I will not thank you for that. When you ask questions, I will thank you for that. Thank you for everything, and thank you for always being here. Thank you for supporting our talk with Kemi, and thank you for listening to Dr. Dustin tonight. Dr. Dustin, thank you so much, ma'am. It was so amazing having you aboard. We appreciate you, we celebrate you, and we look forward to doing so much more with you. Thank you so much, everyone. Dr. Dustin, are there any final words you'd love to say to people? Are there any final words? Okay, let me just bring you up so you can talk. Any
Okay.
final words to our dear
So
females?
the final words I would like to let people know is that contraception is for everyone. No, I've gotten questions like, why are you involving teenagers? And I'm like, do you know that the highest rate of maternal mortality from unsafe abortion is common amongst teenagers? Why not create that awareness about safe sexual practices? Why not let them know about the birth control options to avoid stories that touch, instead of selecting the category of people you need to teach everyone irrespective of their age. Trust me, these teenagers are sexually active. They're not just telling everyone.
They are
Then
searching things online. Their eyes are it's
exactly,
everywhere.
exactly. So we need to create more awareness about family planning. We need to let people know about it. Then let people have access to it. It's so unfortunate that despite everything we are doing, just 37 percentage of women have access to it. We need to do better. Then you can always reach out to me on Instagram if you have questions, or you need to do anything, or need to get more clarifications about today's topic. Thank you.
Thank you so much, Dr. Dunsi. By the way, our dearest Dr. Dunsi also wrote a book. So please, she will send the link to me so that I'll post it as well in case she would love to, get the book and gain. I'm sure that maybe she mentioned 50% of what's in that book. We are talking about an international speaker. So that book is loaded, please. So ensure that you get the book. And I believe that with the book, with tonight's session, in fact, you've turned to pro in family planning. All right, you already have the basic knowledge needed for you as either a single, a married, or in a relationship, or any category you fall into. Thank you so much once again, Dr. Dunsin. We appreciate you and everyone that's tuned in tonight. Please do not forget to subscribe. And I shall see you again next week, May 17, to discuss immunization. Come ready with your questions. And if you still have questions from tonight's session, don't hesitate to reach out to me. If you don't want to ask publicly, you can ask privately. And I'm saying this, we are committed to you, both offline and online, anyone that works for you. Thank you so much. We love you. We appreciate you. And thank you for being a part of family planning and
Thank
contraception. It was so amazing. It was amazing because you were there and you stayed, and were interacting with us. We love you, Dr. Dunsin. Do we
you
tell them we
too.
love them?
I love you, Hawa.
Yes. All
Yeah.
right. Thank you so much. Lots of love, hugs, and kisses from I and Dr. Dinsin and the whole team at Health Talk with Kenny. We love you and we celebrate you. Until we meet again, go and chill on this session. All right. Go and, listen to it all over and all over again. All right. Thank you so much.
Right.
Bye. 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 Good night. Bye, everyone. Bye. 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 Good night. Mwah.